If you have pain right here in the front of your shoulder, the exercises in this video can help to fix it. My name is Dr. Jared, and in many instances, this anterior shoulder pain is due to a condition known as biceps tendonitis. Your biceps is this muscle right here on the front of your arm. It has two heads, or two regions. It has the short head that attaches to the front of your shoulder, but the long head of the biceps actually crosses through your shoulder joint and connects a little more on top. It's this long head or this long tendon that can get irritated with overuse and cause this pain here in the front of your shoulder. A quick, simple test that you can do at home to see whether or not this might be your case is to bring your arm in this position with the palm up, and then with your other hand, try to push down on that arm while resisting that motion. If that recreates some of that pain, that tells me that this could be your condition and you might benefit from the exercises in this video. While it is a biceps tendon problem, the actual cause of the problem is the spacing and functioning in your shoulder. So we need to create a little more space. We need to improve the mechanics at the shoulder with some rotator cuff strengthening, and then we need to do some biceps specific strengthening to heal that tendon. Of course, you get all of those in this video, and we're gonna jump in right now. Now, the first thing that we need to talk about when it comes to rehabbing a tendon injury is this idea of load management. This is an overuse injury. It comes on gradually over time in response to stress. We need to decrease that stress while it heals in order for that healing to occur and in order to get you back to pain-free function. So I need you to decrease weight, decrease reps, decrease sets, or even just decrease the range of motion of the activity that you're doing until it starts to feel better. Said another way, keep things as pain-free as possible while we're working with these exercises with the goal of eliminating pain to progress back to full intensity of exercises. So that's key important part number one. Let's jump into what you can actually do to heal this thing. First thing I like to start with is going to be a massage to that area, specifically a cross-friction massage in order to free up adhesions and stimulate healing in that tendon. And so I'm going to sit with my arm supported. You can either support it on a desk or a table or even right here on your thigh, whatever's more comfortable for you. Then with my other hand, I'm going to touch the front of my shoulder and use a couple fingers to just kind of dig in there and move laterally back and forth. And what you'll feel underneath there is this cord rope-like structure. That is going to be your biceps tendon. And then I'm going to apply a pressure, pretty good pressure into there, and then I'm going to move laterally back and forth over the top of it. And as you do this for the first approximately 30 to 60 seconds, that might be pretty tender in there. But what you should notice is as you continue to do it, the tenderness starts to decrease and it actually starts to feel pretty good, just as blood flow comes into that spot and as we kind of free things up and get them ready to move. And so with that, I only recommend about 2 to 3 minutes a day to get started before we jump into stretches. I've got 3 great stretches to show you for this shoulder pain. My goal is that you identify 1 or 2 or even all 3 that work the best for you, and then you're going to perform those regularly throughout your day, up to 2 to even 3 times a day. The first one, we're going to grab something like a golf club, a broom, a mop, a dowel, a cane. All of those work really well. But what we're going to do is basically keep the elbow straight and introduce some extension at the shoulder. And that puts that biceps in a maximum stretched position. It's also a great way to create a little more space in the front of the shoulder. So to do that with this golf club, let's say that my right arm was the one that's affected. I'm going to put the head of the club right here in my right arm, straighten the elbow, and then with my other hand, I'm going to push that golf club to extend the shoulder back behind me until I get a good stretch right here in the front of the shoulder. You're gonna hold it in that stretched, extended position for about 20 seconds and then repeat that 3 times. That's stretch number 1. Stretch number 2, you can do at a desk or a table or a counter. I'm going to sit down so that my treatment table's at the right height for me. But the simplest way to get into this is I'm gonna put my palm right here on the top of the desk and then rotate away from it. So I'm just gonna rotate my body away from it. And you'll see what that does is that creates that straight elbow, extended shoulder position that's going to stretch that biceps and stretch the front of the shoulder. I don't want you to lean forward with this. If you try that out, it just decreases the tension in the biceps because I'm bringing my chest down. Try to keep your chest up nice and high. As you raise that chest up towards the ceiling, you're going to really enhance that stretch through the front of the shoulder. Once again, comfortable position, 20 seconds, repeated 3 times. And then finally, stretch number 3, you're going to do in a doorway, or if you have a squat rack available, you can certainly do these in a squat rack, just a firm spot to anchor your hand. We're going to pretend now that the pain is here in my left shoulder. I want to extend my shoulder and I want to keep my elbow straight. And so I'm going to just put my hand right on the inside of a door frame and then step into it or step through that door frame until we get extension at my shoulder with a straight elbow, just until I feel a good stretch here in the front of the shoulder. And what I like about this one is you can start down here low and see how that feels. We can also raise the hand up a little bit and see how that feels. You can kind of vary where your shoulder is, where you feel that stretch in your shoulder based on your hand position. We're gonna hold for 20 seconds. We're gonna repeat 3 times. Next, that brings us to our strength training exercises. And as I mentioned earlier, our focus here is rotator cuff strengthening to improve how the shoulder functions. And so I've got exercises that are certainly going to help you out there. But before I jump into there, I just had to ask, did you know about Tone and Titan's members area right here on our YouTube channel? This is something that I'm super excited about. We have different tiers and different perks that are available, from simply supporting the channel to a private video library to even joining me live once a month for a special call that's for members only. If you're interested in learning more about it, hit the join button down below. I'd love to see you on the back end of that members area. Okay, let's get into these strength training exercises. I've got 3 that you're going to love that are really going to help your shoulder out. The first thing I want to do is strengthen those external rotators, basically to pull the shoulder blade into a better position and minimize stress on that biceps tendon. One simple way that you can do that is with some side-lying shoulder external rotation. And so I'm going to lie down on my side. I've got my injured shoulder up. I'm going to grab this small weight. You can use a water bottle, you can use a can, anything that's just going to add a little bit of some resistance. Keep your elbow tucked right in here to your side. Keep your elbow at a 90-degree angle, and then you're going to use the muscles right on the back of your shoulder to pull the back of your hand up towards the ceiling and ultimately to the wall behind you. And then we're going to slowly return back down to that starting position. I emphasize slowly. We want to slow down the negative. That's a great way to promote strength and also promote tendon healing as well. And so that's what that external rotation exercise looks like. I would do about 10 to 15 repetitions of this and then try to repeat it 3 times. Our next exercise, we're actually going to combine external rotation with some shoulder flexion, which is one of the passive movements that the biceps does perform, but really we're going for scapular stability and scapular control with this one. I have this small resistance band. I'm going to put it around my wrists, and then I'm going to pull into this position. That's that externally rotated, or that external rotation position. If you don't have these bands, I've got some linked down below. They're pretty cheap to pick up. You can also get a belt, just like a belt that you wear around your pants, and then loop that around your wrists and just pull into that. Not quite as effective, but you do feel those external rotators kick on. And so from here, I'm going to hold in this position about shoulder width with a slight bend in my elbows. And then I'm going to raise up just like this with both of my hands while maintaining that external rotation force, and then return right back down just like that. I want your shoulder blades together. I want your chest nice and high, and I want you to feel that right in the back of your shoulders and even the muscles between your shoulder blades. We're going to repeat this 10 to 15 times, and we're going to do that for 3 repetitions. And then finally, let's do an exercise that is specific for that biceps to promote some healing in that biceps tendon. These are going to be some eccentric biceps curls. The concentric motion, or the motion of raising, tends to put a little bit more stress on the tendon. But the motion of lowering is a good way to put tension through the muscle and through the tendon without eliciting a lot of pain. So what I want you to do is grab some weight, and we're going to help it up into this position. Now from here, this is the eccentric part, you're going to nice and slow lower that down for about a 4 or 5 second count until we're all the way extended here at the elbow. Now with my other hand, I'm going to help up into the top of that position again, and then we're going to go down nice and slow once more. The slower you go, the more you emphasize that eccentric motion, the better it should feel. Pick a weight that you can do 10 to 12 reps without a significant increase in your pain. 3 sets of 10 to 12 there is what I typically recommend. I hope these help your shoulder to feel amazing, and thank you so much for watching.